Good evening, everyone. My name is Michael Betel, and I'm the president and founder of the Fatty Liver Alliance. Welcome to our first annual European Primary Care MASLD MASH Summit. I'm honored to join Marko Korenjak and Dr. Juan Manuel Mendive as we open tonight's program. And of course, all of our special guests are ready to speak with you. Across Europe, the burden of MASLD and MASH continues to rise, driven by metabolic dysfunction, obesity, diabetes, and social determinants of health that challenge families and healthcare systems. Yet, despite its prevalence, most people living with MASLD or MASH remain undiagnosed. Many have never received a liver assessment. Many have never discussed their liver health with a clinician, and many do not recognize that their metabolic risks also carry liver risks. Primary care has the power to change this. Tonight's program is designed to equip frontline clinicians with practical, evidence-based approaches you can use tomorrow. Unless you're working today, and then it's today too. You will hear about clear guidance on definitions and nomenclature that reflect the latest global consensus, tools for integrating non-invasive tests, lab markers, and fibrosis stratification into routine visits, the patient voice, highlighting barriers that are often invisible in clinical guidelines, and lifestyle strategies that actually fit the realities of European primary care. Thoughtful, balanced discussion of medication options as part of holistic metabolic care, and a case-based panel addressing the complexities you face daily in practice. We're here because early detection matters. Empathetic communication matters, and empowering patients before disease progression takes hold matters. Thank you for taking the time to strengthen the role of primary care in metabolic and liver health. Your commitment has a direct impact on individuals and families across Europe who are living with MASLD and MASH and those who are still unaware that they are at risk. I'd like to now introduce Marko Korenjak, who is the president of the European Liver Patients Association, also known as ELPA, representing 39 associations across 29 countries. He serves on the EMA Management Board, leads ELPA's involvement in 20 EU Horizon projects, and is active in World Health Organization and EU health initiatives. Marko was even recognized by The Economist as one of the most influential figures in hepatitis elimination, and he received the PFMD Made with Patients Award in 2024. And over to you, Marko.
So thank you very much, Michael. You are too generous, and congratulations on this event. Overall, ladies and gentlemen, it's really an honor and a privilege to say some welcome words to this MASLD and MASH summit. I stand here not just as an advocate, but as a liver patient, someone who understands firsthand how uncertainty, the daily challenges, and the hope that are coming with the chronic disease really look like. For patients, MASLD and MASH are not just scientific terms; they are just live experience. They affect how we work, how we plan our lives, how our families feel every single day, and that is why this meetings like this do matter, because with every discussion here, we have the potential to change real lives. As patients, we ask just for three things. We ask for early diagnosis so that we are not discovered too late. We ask for clear and compassionate communication so that we truly understand our condition. And of course, we ask for research that is shaped by real patient needs, not just by clinical endpoints. Today, as we are joining here not just as observers, but I feel as partner. So we bring our experience, our concerns, our determination to move things forward. My hope is that this summit will not only address scientific issues, but it also will strengthen the connection between research and the people it is meant to help. Thank you very much, and a very warm welcome from my side.
Marko, thank you so much for all that you do and all that ELPA does every day. We all appreciate it. Dr. Juan Manuel Mendive is a family physician at Lamina Primary Care Academic Center, University of Barcelona, and president of ESPCG. His work focuses on gastrointestinal issues in primary care, especially MASLD and SLD. He has contributed to international MASLD projects, educational programs, and major initiatives like the EASL Lancet Liver Commission and Healthy Livers, Healthy Lives, and authored numerous papers. And over to you.
Thank you. Thank you very much, Michael. And thank you very much for this invitation, very kind invitation to participate in this, I expect, successful MASLD and MASH summit. And from the primary care perspective, I will try to take this welcome to all participants and to wish you a successful meeting. And I'm sure it's going to be, because the program is just great. And if I've gone through it, I'm just going to be to say a couple of things. If I can have this first slide, just to provide this primary care perspective, telling you that I'm apart from academic primary care center where I'm working in a day-to-day practice, and the chair of ESPCG, that's the European Society for Primary Care Gastroenterology. The society is under the umbrella of both the Global Society for Primary Care Doctors, that is WONCA, and also the European United European Gastroenterology UEG. Next slide, please. Just a very brief comment. The next slide, yeah, about how primary care is having this very relevant role, I think, because as primary care doctors, we see most of MASLD patients, but we are seeing them usually for different conditions, rather these patients of us as having more obesity, hypertension, diabetes, dyslipidemia, cardiovascular risk assessment, or for whatever kind of holistic management for these metabolic complicated problems. But most primary care doctors are seeing these patients without any specific liver approach. So this is the key issue for us in a day-to-day practice. Next slide, please. And having said that, from primary care, we should be focused on the importance of screening, diagnosis, and follow-up these patients, because most of the time we are going to be the only doctors seeing these patients. So management on diet, weight, and exercise to specific approaches that are more on the shoulders of the knowledge from primary care doctors have to be on a day-to-day practice. Whenever we need to make another specialist to be having the follow-up of these patients to target a specific metabolic syndrome components, for instance, and we have other specialists, cardiovascular specialists, or even hepatologists when necessary for management complications, cirrhosis, or MASH whenever necessary. So this pathway for management should be always very clear in this management care. Next slide, please. And just to make you aware that ESPCG is working in the last few years because we are aware about the importance of education from primary care for primary care doctors. We've been trying to develop activities all around Europe. We tried to do educational meetings a few years ago in different countries, and this year also in Barcelona. We're still on trying to do it, and this is our webpage, and we hope to be continuing this kind of collaboration in Europe and worldwide, and we wish all of you a successful meeting. Thank you very much.
Thank you so much, Juan. I really appreciate that, and that you were able to join us today too. I'm now going to introduce our moderator for this evening, Professor Jeffrey V. Lazarus. He is going to be the moderator for the entire event, and I really appreciate, Jeff, that you're able to do that as well. He's a full professor at CUNY Graduate School of Public Health and head of the Public Health Liver Group at IS Global, former WHO Europe official and vice chair of the EASL International Liver Foundation. He now directs the global think tank on steatotic liver disease and leads MASH cities. He's authored over 450 publications and received major awards from the American Liver Foundation and ACE. And on a personal note, I want to add that Jeff is a very passionate leader and global contributor to MASH awareness, and he's a very close friend of mine, and we are all in really great hands tonight as Jeff being the moderator. It's going to be really great. And over to you, Jeff.
Well, thank you so much, Mike, for the wonderful introduction, and thanks so much, Juan Manuel and Marko. It's great to have you on board with such diverse voices. So now we're on our fourth person speaking, and none of us are a hepatologist, but that's about to change.